Hello guys, I'm Sajad Pathan and welcome to the second part of EM question of the day. What is the most common agent involved in the ED? A patient undergoes rapid sequence intubation. He's sedated and paralyzed. He was admitted with persistent vomiting and diagnosis of aspiration pneumonia was made. 30 minutes after the RSI, his observations are blood pressure of 145 by 80, heart rate 125, EtCO2 5.9 to 6.2, saturating 96% on 40% FiO2. The options are fentanyl, ketamine, ondansetron, metronidazole, suxamethonium. Let's break this down. What is the diagnosis here under consideration? It's post RSI, and what you see is tachycardia and a raised EtCO2. So, what is the diagnosis? The temperature is normal and everything else seems to be okay. But here you need to remember the diagnosis here post RSI likely to be malignant hyperthermia. Malignant hyperthermia is actually a misnomer. The earliest sign you see is not hyperthermia, but you see is tachycardia and rise in EtCO2. The muscle rigidity part and hyperthermia will occur very late. Patient is intubated, so the first sign is tachycardia and raised EtCO2. And the most common drug in the emergency department or in theaters is suxamethonium or succinylcholine. We need to differentiate malignant hyperthermia from other stuff, such as neuroleptic malignant syndrome and serotonin syndrome. Serotonin syndrome is autonomic instability with altered mental state and myoclonus. The most common agents are the antidepressants such as TCA, SSRI, SSNRI, MAO inhibitors, either by itself or in combination. But also think of the lot, these drugs which we sometimes give to our patients. Linezolid, which is an anti-MRSA drug, LSD, which is the drug of abuse. Ondansetron is so commonly given. Imagine a patient you have in the ED who takes a TCA and he's been actively vomiting and you want to give ondansetron. It will interact with the TCA or any other antidepressant and can lead to serotonin syndrome. Tramadol is another one. Whereas the neuroleptic malignant syndrome is, I think of it as a patient who's on antipsychotic and then he becomes Parkinsonism like. So, autonomic instability, altered mental state, and rigidity. So, they both can have hyperthermia, they both can have tachycardia and raised blood pressure. But here, the scenario mentioned was of a post RSI patient, and likely in the RSI, you have used the succinylcholine or suxamethonium and you have caused it. Let's look at step ahead. What do we do in all these cases when the temperature is high? When the temperature is high, you do active and passive cooling. Paracetamol doesn't work. Paracetamol should not be given. If this does not bring the temperature down, what we have to do is we have to use something called as dantrolene, which is a ryanodine receptor blocker, or in simple term, calcium channel blockers in the sarcoplasmic reticulum of muscle tissue. Specific antidotes for serotonin syndrome are cyproheptadine, and for NMS it is bromocriptine. I want you to take some time off and reflect on the basic sciences where we learned about the anatomy and the physiology of the actin myosin filaments and how the calcium is released from the sarcoplasmic reticulum and leads to muscle contraction. This will be essentially important for those appearing for the FR Chem primary exam. Good luck studying. See you soon in the next video.